Hi, everyone. My name is Leah Hillman, and I have been an RT for a little over 5 years now. I work at a hospital in Southern California at a university medical center. I am currently an RCP3, so I go to all units of the hospital. At my facility, we do have a very short staffing issue, and so we run with about 5 to 6 RTs on an average day, and on a good day, maybe about 7 to 8. Um, we are expected to go to every unit at our hospital. So I work labor and delivery and NICU. We are currently a level 2 NICU. We have a full adult ICU and ER and general floors for adult patients. So we do have a wide variety of opportunity to go to different units at my facility, which is cool. We also do bronchoscopy and PFT. And so I like that you get to go to every different unit and maintain your skills in every different department. Um, what got me into respiratory care was a little bit of fate, actually. I was at a procedure with my mother-in-law, and while she was getting her pre-procedure check, this girl came up to me and was mentioning respiratory therapy and how her friends did this program and they thought it was great. And I had previously told her that I was looking into nursing, but that the programs were very competitive in my area and that it was hard to get into a program in a timely manner. And so I was on a wait list, and she had said how fast this program was and how great it was. And so when I went home that day, it was weighing on my mind a little bit to look into this respiratory therapy program that she had discussed. And when I looked it up, everything about it seemed great. It really fit my idea of what I wanted from a healthcare career. And so that next day, I looked into the school a little more, called the counselors, and set up an appointment. And then within 2 weeks, I had enrolled in the program and had started. And so I feel like it was just my push to get into the respiratory field was just that little bit of divine intervention from this pre-procedure lady at the hospital that I currently work at, ironically. And so I think it was just meant for me to become a respiratory therapist instead of a nurse. And I have loved every second of it. It's been the most rewarding career path and one of the best career changes I could have made for myself. And I hope you all feel the same way about your career in respiratory therapy. One of my favorite things about being a respiratory therapist is the fact that we do get to branch out into every unit, and we get to have skills in pediatrics, adult critical care, specialty things like PFTs and bronchs, and just being able to maintain a wide variety of skill. I think that's really cool. I feel like with maybe nursing as a field, you're assigned to maybe a tele floor or a post-op floor, and you kind of stay in that realm of whatever you were assigned to. Whereas with respiratory, we go everywhere. So we get to just really experience a full day of, we don't even know what's coming in. You could start your day with a neonate and then end your day with a full code in the adult ICU. And I think it's cool that we just get to go all over the place and be a part of everything. And then another thing that I really love about it is the high acuity element. So with respiratory, we get to go to every code in rapid response. And for me personally, I think the little bit of adrenaline that you get from those kind of high acuity situations is really fun. And I personally enjoy going to codes and trying to play an active role in saving a patient's life. And if I could just be a rapid response or code RT, I would absolutely do that day in, day out. I think it's just so great to be an active member of the clinical team that's trying to help resuscitate somebody and using your clinical knowledge and critical thinking to come up with ways that we could save a patient's life. And most of the time, getting that outcome that you want and taking care of that patient and then making sure that they can live a long life after your interventions. And I think that's just really something beautiful about our job. And obviously, it does come with its highs and lows, but that is for me one of the things that I love most about it is that I can play a role in actually saving somebody's life. And so for me, that's my favorite part of respiratory therapy. And then lastly, for my favorite dinner meal, I do live in Southern California. So anything Mexican food, anything street tacos or on a tortilla, I'm all about it. Out here, the food for Mexican food is amazing. So you can't go wrong with that. And so that's just a little bit about me, why I got into respiratory, what I like about it. I look forward to listening to your guys' videos and seeing your responses. And I hope that we all get what we want out of this course and keep continuing on our bachelor's program. And hopefully we all graduate soon and move on to that next step in our career. But in the meantime, I look forward to taking this class with you guys and seeing what it has to offer for all of us. So it was nice to meet you all, and I will hear from you soon. Take care.